Greetings, colleagues. My name is Paul Phrampus. I'm the director of the Winter Institute for Simulation Education and Research, otherwise known as WISER, at the University of Pittsburgh, way over here in the United States. And I'm glad to be back at this conference. My only regret and my emotional tugging is that I can't be with you in person again this year. Hopefully, we're going to correct all of that soon. I want to start off by talking about owning the educational space and some of the new roles of the simulation centers. What does that mean? We're going to discuss this over the next 20 or so minutes. I want to extend a big thank you to those that are organizing the conference. I'm a visiting professor at Taipei Medical University. I couldn't be prouder of the CEMS Center and the accomplishments that have gone on over the last decade and advanced to move simulation efforts and the program curriculums of the various schools of Taipei Medical University forward to become truly world leaders in academic education, preparing the healthcare workforce of the future. I'm so excited. I appreciate you inviting me to be involved in your conference, and I wish you well, and I want to say thank you. So, I want to talk a little bit about COVID, not because we haven't talked enough about it, but I want to use it as an agent of change and think about how we can reposition our world in simulation and simulation educators, simulation enthusiasts, and champion the cause, move things forward, and solidify simulation in the curriculum and how simulation centers are viewed, as well as make things better for everyone involved in education, everyone involved in the delivery of healthcare, and most importantly, the patients that we serve. COVID has put a lot of pressure on healthcare systems from lots of different angles. There's changes in the way care is provided. There's changes in the education. There's changes in the spread of the disease that are going on. And I think we're transitioning from the state of fear to the state of learning how to live with the disease in our societies. But definitely it's changed our social interactions. And what I want to focus on for the next 20 or so minutes is the training plans and how we can impact staffing in hospitals as we start to encounter global shortages of healthcare workers and people that have a desire to take direct care of patients. I think some of it has to do with COVID. Some of it has to do with the work environment that people were subjected in even before COVID. And COVID has kind of brought everything to a boiling point and made it so that some people don't even want to work in the healthcare space anymore. And the ripple effect that has overall is tragic if we don't turn things around. And part of turning things around is our attitudes, our mindsets, our education, our training, and looking out for the workforce that's coming behind us. We need to make sure that we solidify the education and training pathways for all of the schools of healthcare, whether you're a physician, a nurse, a pharmacist, or some other professional in the healthcare environment. We need to be thinking about training future care providers that will be taking care of us when we transition to the role of needing healthcare sometime in the future. I like to always say COVID hasn't changed some things. Patients needing to get high quality healthcare, that hasn't changed. Patients requiring safe care. Everybody that enters into the healthcare system to receive care hopes and thinks it's going to be safe. But we know that we have challenges in the healthcare system that need our attention to make sure that we are providing the safest care possible. I already mentioned the need for education of new healthcare providers, those that are transitioning from not being a healthcare provider to being a healthcare provider, and that long journey in between. And then we're going to talk a lot about, at the end of this talk, that transition from finishing school to starting a new practice. How can simulation affect that? Another thing is the need for essential training has not changed. We need to still provide education and training that is critical to the needs of the patient. And some of that is covered in the general programs of nursing school and medical school, but many other essential trainings occur on the hospital premises or at the hospital bedside because it is very specialized in terms of what a particular healthcare provider is going to be responsible to do. When we think of simulation, we need to think of the resources that already exist within the world of simulation. And I like to break it down and think about there's 4 core elements that simulation centers are always responsible for. And part of where I'm going with this discussion is I think we already have a lot of resources within simulation programs to really speak up and make education a stronger part of the healthcare system. We need to think about students. We need to think about instructors. We need to think about what do students need to learn and how is the simulation center or simulation program aligned to make that happen. With regard to instructors, there's lots of things. We need them to be subject matter experts, to come to us with knowledge of whatever professional domain they come from. But then we also need to infuse them with some skills of simulation. So we possess the skills of faculty development within inside of healthcare simulation programs, and I think we need to harness that energy and move it forward. We also are very, very good at identifying the needs of the equipment and maybe more importantly, the curricular drive to decide what equipment is essential for what training program and how do we pick and choose that piece of equipment that is needed to conduct a certain course. And then lastly, facilities. The facilities that the training needs to take place in, we are expert at that. We know how many rooms we need. We know how many classrooms we need, those kinds of things. And we need to mold all of this together because as we do, that is our curriculum. If you can think of this as a ball and think about the contents of the ball, the 4 core contents are the students, the equipment, the instructors, and the facilities. When we put all of that together, we have a curriculum we need to deploy. And then when we need to deploy that curriculum, there has to be scheduling. We have to have resources aligned. We have to make sure that the instructors and the students know where to go, that we have the equipment on reserve, that we have the facilities to do our simulation-based program in, and so on. And then another thing that we are already expert at in the simulation world is data management. We help create lots of program evaluations, quizzes, tests, examinations, and collect all of that data to help inform the education system how it should be moving forward. But the problem with the way we think about it now is we only think about these resources and these capabilities within inside the simulation center. But I want to challenge you to think that all of the education in healthcare needs access to our expertise, to our comfort and competence with all of these issues that I've laid out for you. So let's switch to a bit more of a practical exercise. All right, here's the picture of a very complex simulation. It's a simulation involving anesthesia and liver transplant surgery, and it's quite complicated in terms of the amount of equipment, the setup, the breakdown, the cleanup, etc. But I want you to think for a second, what did it take to bring this together? Well, the answer is it took a lot of effort, a lot of expertise, and a lot of competence of the simulation program. Let's just start with the curricular materials, okay? There had to be some development of the learning materials, the learning objectives, the things that the students were expected to know before they started the simulation. How about the instructor materials? How to prepare the instructors to teach in such an environment, to do an assessment in such an environment. Maybe they created feedback forms that will give the student a chance to comment on how well the education was conducted. I think another area of expertise of a lot of simulation programs is the development of assessment tools. How do we know that students are performing up to a level that we want to call competent or acceptable. And once we aggregate all of those scores, and this goes to the data management piece, how do we know that our program, our entire program, is performing adequately and that we don't need to modify our curriculum to serve the needs of future students? We need to think about quality improvement and quality assurance built into our curriculum resources. This is quite complicated, but it's something that we do a lot in the simulation world. But again, we only do it in the context of the simulation world, not in the greater space of healthcare education. Then let's just think about the logistics, operation, administration, the scheduling that needed to occur to reserve all of this equipment, to reserve the room. Materials had to be ordered. There had to be equipment set up. This particular equipment setup takes over an hour. Troubleshooting that goes on if there's technical failures within any of the technical instruments that are used inside of this simulation. And then after the training is over, somebody has to come behind, clean it up. There's lots of administrative responsibilities like billing and finance and lots of other nuances that are already contained inside the expertise package inside of a simulation program. And I mentioned the data analysis and reporting. We want to report on our efforts as a simulation program, but also we have to recognize that the bigger healthcare instructional unit or education unit of our system needed to have justification for the spending that is spent on simulation, the spending that is spent on all types of education, and invest more in those things that work and invest less in those things that don't. All of that, to direct that, requires a careful amount of data analysis. So inside the simulation center, we provide support. We provide support that allows people to take good ideas and good training endeavors and make them into successful programs. And this is what every single training encounter does, whether it involves simulation or not. If you think about it, we still need a lot of those core resources like students and faculty, sometimes equipment and sometimes facilities, even to do PBL or small group learning. And how we provide support from the simulation center perspective, I think, allows us to position ourselves in a very powerful way moving forward to go to hospital and university leaders and say, hey, we're simulation. We are critically important to the mission of the hospital and to the medical school or nursing school, and here's why. Not only do we do simulation with excellence, but we can support all of your education needs. So what do I mean by support? I'm going to show you how we break down support at Wiser. We think of those administrative things that I talked about when I showed you that example simulation. We think of administration in terms of billing, in terms of partly being responsible for the scheduling, human resources, and deciding what does our simulation program need in terms of support from humans. Faculty development. This is a big one. Many people teach at the bedside and become teachers just because they are nurses or physicians, not because they've had special training, not because they've undergone any kind of professional development activities that have made them into a better instructor. Within the simulation world, it is very typical for our instructors to have gone through entry-level training, maybe psychological safety, maybe debriefing, maybe higher-level courses. But the point is, they are more down the pathway of becoming a professional educator as opposed to somebody who just starts teaching because they are a doctor or a nurse. The other support includes technical. A lot of people, when they have to have technology involved in their education, they get a little nervous about it. They worry about technical failures, or they think that they can't do it because it's too technical. And the Simulation Center usually has support for that. I talked a lot about the data management, but I think it's very, very important as we collaborate with hospitals and schools of health sciences to make the case that the Simulation Center really owns education. We want to help them with data management. We want to be collecting data so that we can define the return on investment that we bring to the system. And the last part is the curriculum development. This is another area that I think a lot of simulation centers around the world, the expertise of curriculum development is going up significantly within the walls of simulation programs. And how we can export some of that knowledge and capabilities and help to drive change is critically important. And I want you to think about driving this change in education as it's associated with the disruption that I talked about from COVID earlier. So all in all, I think we have a model that emerges. This is the model we use at Wiser, but I want to encourage this in terms of how to own the education space. And that is we create partnerships between subject matter experts and those on the simulation center side. And I have some of those skills listed, like the support mechanisms that I have been talking about already, like curriculum development, managing the project of how to build some bigger program of education. Think about that complicated simulation that we looked at and I showed you a picture of. Managing the equipment such as projector equipment, or maybe a microphone, or maybe a simulator, or maybe some materials or supplies from the healthcare space that we need, and the overall operations of the center. How do we make these things happen? How do we manage that flow of those 4 key components that I talked about before? Administration and faculty development come with our side of this partnership equation. And what this partnership equation allows is the generation of expert curriculum that includes simulation. And that's an important part of the future. But really what I want us to think about for the future, with all of the disruption that COVID is causing and all of the disruption in the healthcare environment currently, is how can we take the resources that are inside of simulation programs already, continue to mature them to the next level, and then make them available to the entire education program of our hospital or our health system. That's where I think we need to go. We divide it up like this at Wiser, and I think that you can think of this, whether you're talking about PBL activities, standardized patient activities, or activities with simulators, or even activities at the real clinical bedside. And I'll get back to that in 1 minute. But we think of it in 3 different sets of components. One is preparation material, having the learners undergo online learning, or maybe a lecture or other kinds of reading or assignments to become familiar with the knowledge that they need to be successful when they engage in the hands-on learning. Then that middle component I'm talking about from a simulation perspective is the on-site practice or simulation. Opportunities with feedback from faculty members and other experts that can teach in this environment to allow people to engage in deliberate practice and do things over and over again until they perfect them and we call them competent. And lastly, some sort of data gathering mechanism in the form of assessments. We want assessments of the students, assessment of teams of students, assessment of whole classes of students to help inform levels of competence at the individual healthcare provider level or individual level of the entire program, such as how is our school performing, and everything in between. Now I want to go back to 1 second to that middle section, this on-site practice and simulation. We could substitute out bedside teaching for this as well. So we can do part of the activities in the simulation center and simulation program like we do now quite expertly. And we can change this out for, let's go observe how our students are doing when they interact in the real clinical environment. Okay? So we need to think beyond the box of just the walls of the simulation center. So let's think of a practical application as it relates to problems associated with the healthcare shortage of providers in terms of COVID disruption. Well, there's a need. There's a need to help people transition from their role as a student to actually being a practicing clinician, whether that's physician, nurse, pharmacist, some other role in the healthcare system. If we think about the education process, we have students entering, we have students graduating after 1 year, 2 year, 3 year, 4 year, depending on the types of programs, and we say they have met the educational objectives. Well, when they transition to the hospital to start their real clinical job, their functioning is rather low, and they start there as a new hire or new employee, and it's our job on the healthcare system side to bring them up to be a competent, independent clinician. So that white space between the dark blue area and the light blue area is what I call the practice gap. And I've been saying for years that this practice gap is an area that is just begging for simulation to shrink this gap a little bit, to make that clinical functionality a little bit higher when they hit the ground. So I think simulation programs, whether you're affiliated with the school side or whether you're affiliated with the hospital side, can take ownership of this education space to solve the problems, solve the gap of finishing school and graduating and starting as a clinical practicing provider. I want to assure you that this practice gap has grown huge now in the times of COVID. And our ability from a simulation program to own the education space, to shrink this practice gap into something smaller, is right in front of our eyes. We just need to approach it with creativity and with passion. Passion for education, passion for expertise, passion for raising the quality and safety of healthcare. So what I'm kind of showing is I think the simulation world should be a public utility like electricity. And this simulation world has all of the expertise and knowledge on the day-to-day basis now that we need to own the entire education space for healthcare providers' journey to become competent graduates of programs, as well as move them along the journey of providing education, training, and expertise that allows them to cross that threshold from graduate to practicing professional. And I think the simulation programs that exist today, that exist in universities like yours, already have the competency to stand up and take over the education space so that we can make professional decisions and create the relevance of the training and education that will allow us to make this transition into the healthcare of tomorrow. So those are my thoughts, and I hope this kind of kicks the symposium off and the symposium is successful. I look forward to interacting with you in the Q&A and afterwards. So what I'm trying to say in summary is let's rally. Let's take advantage of the expertise that already comes from within simulation programs. Let's go to leadership, demonstrate we have the foundational skills necessary. We can manage those 4 core things that have to do with education programs, such as students, such as instructors, facilities, and equipment. We can power education across the healthcare spectrum to improve the quality of healthcare and improve safety everywhere around the world. So thank you very much. I hope that you have a good symposium and learn a lot. My contact information is on the screen in front of you, and I'd look forward to hearing your feedback, and I wish you well. And I hope to see you soon in Taipei. Take care.